So look around and you'll probably notice a kind of strange paradox in our modern world. Thanks to some absolutely incredible medical advancements, we are living longer than ever before. But are we actually living better? The truth is, we're currently facing this unprecedented crisis of chronic diseases. We survive the heart attacks, we beat the infections, but then we spend decades living with persistent fatigue, chronic pain, stress, and metabolic dysfunction. It really begs the question, in our massive rush to embrace futuristic medicine, did we accidentally overlook the foundational blueprints of true health? Welcome to This Explainer. Today, we're diving into the source material to see if a 2 millennia-old medical system might actually hold the exact missing piece to our modern healthcare puzzle. Okay, let's get into it. We're going to be exploring the really fascinating integration of Ayurveda into modern, evidence-based healthcare. We'll look closely at exactly how this ancient wisdom is currently being tested, validated, and safely combined with contemporary clinical science. Here is our quick roadmap for the explainer today. 1. The science of life. 2. Bridging two medical worlds. 3. Evidence for Ayurvedic botanicals. 4. Safety and quality assurance. And 5. The future of integration. Let's kick things off with Section 1, the science of life, ancient roots of preventive health. Originating in the Indian subcontinent more than 2 millennia ago, Ayurveda is literally one of the world's oldest continuously practiced medical systems. And the word itself? It translates to the science of life. It's all detailed in these amazing classical texts like the Charaka Samhita and Sushruta Samhita. And it goes way, way beyond simple herbalism. The source material reveals that Ayurveda doesn't just view health as the absence of a disease. Instead, it sees health as a dynamic, continuous balance involving all your physiological, psychological, and environmental factors. It encompasses everything from nutrition and lifestyle to surgery, toxicology, pediatrics, and preventive medicine. The whole shebang.
What's really wild is that Ayurveda actually pioneered the concept of personalized medicine thousands of years before we ever mapped the human genome. They call this Prakriti. It's this fundamental recognition that every single person has a unique baseline, a totally distinct physiological, metabolic, and psychological constitution. Because your Prakriti is unique to you, your dietary needs, your stress responses, and even your predisposition to certain diseases are entirely your own. So a one-size-fits-all approach to health, it just doesn't make sense here.
Now, to maintain that unique balance, Ayurveda relies heavily on dinacharya, which means structured daily routines, and ritucharya, which is seasonal adaptation. This is really all about aligning your behavior with natural physiological and seasonal rhythms. Think about your sleep hygiene, daily physical exercise, and specific dietary practices. Beyond these routines, traditional treatment strategies often involve a carefully tailored combination of dietary modification, targeted herbal preparations, detoxification procedures, physical therapies, and behavioral recommendations. Instead of just waiting around for a disease to show up, these proactive habits and strategies act as your very first line of defense.
Moving right along to Section 2, bridging two medical worlds, firefighters and architects. So how exactly does this ancient framework compare to, say, the hospital down the street? Well, think of Western medicine as a team of elite firefighters. It is incredibly evidence-based, technologically advanced, and absolutely exceptional at acute, reactive care. I mean, if you have a heart attack or a severe infection, you absolutely want Western medicine. But Ayurveda, it acts more like the architect. It's holistic, proactive, and lifestyle-based. It's designed to essentially fireproof the building in the first place by focusing on long-term systemic balance.
And this brings us to a really critical concept in the sources, the residual burden. Because Western medicine is so incredibly good at saving our lives from acute threats, we now have an aging population living with the chronic aftermath. We survive, sure, but we carry this heavy residual burden of persistent fatigue, sleep disturbances, anxiety, and metabolic dysregulation. Western medicine sometimes struggles to treat this prolonged loss of quality of life because there often isn't a clear single pharmaceutical target. And that is the exact gap where Ayurveda's focus on resilience and whole-body function steps right in.
Which leads us perfectly into Section 3, evidence for Ayurvedic botanicals, the clinical data. Let's look at the hard science.
Contemporary scientific research isn't just taking these ancient texts at their word. It's actively investigating these formulations in modern laboratory and clinical settings. We're seeing specific clinical problems being directly matched with targeted Ayurvedic interventions along with their current evidence position. For example, for something like knee osteoarthritis, combinations of certain herbs have shown moderate evidence for short-term pain relief. And for stress and anxiety, standardized ashwagandha is showing some very tangible results in regulating the body's stress response.
The research really highlights 4 major botanicals in particular. First up, curcumin, which comes from turmeric. It's been heavily studied for its ability to biologically inhibit inflammatory mediators, acting on the exact pathways that drive chronic joint pain. Next is boswellia. This one inhibits leukotrienes, offering established clinical benefits for structural pain, like that knee osteoarthritis we just mentioned. Then we have ashwagandha, an adaptogen that actually helps regulate cortisol and neuroendocrine pathways to significantly improve your stress resilience. Finally, bacopa, which demonstrates real neuroprotective effects, supporting cognitive function and synaptic plasticity. Now, it is worth noting from the sources that the quality of evidence does vary considerably depending on the specific medical indication being treated.
And that variation in evidence brings us to Section 4, and this is absolutely crucial: safety and quality assurance.
So the key takeaway here is this: natural absolutely does not automatically mean harmless. The integration of Ayurvedic interventions into modern healthcare requires rigorous quality assurance, regulatory oversight, and really solid evidence-based clinical evaluation. The source material outlines some major safety risks, including inconsistent product quality, a lack of standardization, and, in some preparations, dangerous heavy metal contamination. On top of that, there is a very serious risk of potential herb-drug interactions. For instance, certain herbs might increase your bleeding risks if you're on anticoagulants, or excessively lower your blood sugar if you're already taking diabetes medication. So using these therapies safely means we have to treat them with the exact same clinical governance as conventional prescription drugs.
Finally, let's explore Section 5, the future of integration, anticipatory medicine, and see how we can bring this all together safely.
In the Rajiv Gupta integrated healthcare model, the patient is placed squarely in the center of their care. You're flanked by conventional Western medicine on one side and evidence-informed traditional systems like Ayurveda on the other. It's great because it doesn't ask you to choose between the two. Instead, it uses modern medicine for risk stratification, diagnosis, and disease-modifying therapy, while securely adding structured Ayurvedic tools to address your daily function, your resilience, and your actual lived experience of health. And this proactive care model builds into an incredibly high-tech future. Just imagine pairing 2,000-year-old wisdom with artificial intelligence. In this model, AI connects with your wearable devices to establish a continuous, highly personalized health baseline. Instead of waiting for you to get sick, the AI flags subtle physiological deviations, maybe a slight change in your heart rate variability or some early metabolic deterioration. Once it's flagged, your healthcare team deploys a proactive Ayurvedic lifestyle or botanical intervention to correct the imbalance, long before it ever becomes a costly acute illness.
Ultimately, true integration isn't just about indiscriminately throwing herbal supplements at a problem. As the research strongly emphasizes, it requires the careful, evidence-based incorporation of natural therapies within a strict, scientifically governed patient safety framework. It's really about getting the absolute best of both worlds without ever compromising care. By bridging the acute precision of modern medicine with the holistic, preventative architecture of Ayurveda, we finally have the tools to completely change our trajectory. So the question I want to leave you with today is this: as our technology advances and our understanding of this ancient wisdom deepens, are you ready to stop just passively treating disease and start actively engineering your health? Thanks so much for joining me on this explainer. I really hope this gave you a powerful new perspective on the future of integrated healthcare.